When you think of a heart attack, the image that likely comes to mind is someone clutching their chest and collapsing to the ground. But did you know that a silent heart attack can be even more dangerous because it's so hard to detect? This stealthy type of heart attack doesn't show any obvious symptoms, making it a hidden threat. Picture this: out of the estimated 17.9 million heart attack cases worldwide each year, an astonishing 3.8 million are silent. These unnoticed attacks can cause significant damage and without treatment can be deadly. Thankfully, there are warning signs that can alert you to a silent heart attack. In today's video, we'll reveal the top 10 warning signs of a silent heart attack. Number 1. Jaw, neck, or upper back pain. When you think of a heart attack, chest pain probably tops your list of warning signs. And while it's true that chest pain is a key indicator, it's far from being the only one. Astonishingly, many people who have experienced a heart attack first felt pain in unexpected places like the jaw, neck, or upper back, long before the more commonly recognized symptoms like shortness of breath and nausea even set in. So why does this happen? Imagine your heart muscle as a powerful engine contracting with intense force during a heart attack. This surge can send stress waves radiating through your body, impacting bones and ligaments far from your chest. The result? Aching, discomfort, and pain in areas you might not immediately associate with heart trouble, such as your jaw, neck, or even your upper back. These stealthy signals could be your body's urgent cry for help. Jaw pain that you dismiss as a dental issue, neck soreness you attribute to a bad night's sleep, upper back pain you think is just muscle strain. Any of these could actually be your heart sending out distress signals. Knowing this can be a game changer. By paying attention to these subtle yet significant signs, you can react quickly and potentially save your life or the life of someone you love. So the next time you feel unexplained pain in these areas, don't brush it off. Consider your heart and take action. And Number 2, squeezing chest pressure. When it comes to the heart, any kind of chest discomfort should be taken seriously. And one of the most telling warning signs is a sensation of squeezing pressure in the center of your chest. This type of chest pain, also known as anginal or substernal pain, can feel more like an uncomfortable cramp than the classic Hollywood heart attack scene. But make no mistake, this squeezing pressure is a clear sign that something is amiss with your heart. During a heart attack, the muscle is being deprived of oxygen-rich blood, which can cause this distinctive chest sensation. And the longer it persists, the more damage can be done to this vital organ. Now, it's important to note that not all chest pain is cardiac-related. Issues with the esophagus, lungs, or even musculoskeletal injuries can also cause discomfort in the chest area. But when that squeezing, cramping feeling sets in, it's crucial to act fast. Don't try to tough it out or convince yourself it's just stress. Chest pressure of this nature demands immediate attention. The sooner you can get medical help, the better your chances of minimizing any long-term harm to your heart. Number 3, excessive fatigue. Feeling tired all the time? Don't just chalk it up to a busy schedule or lack of sleep. Excess fatigue could actually be one of the early warning signs of a silent heart attack. In a groundbreaking study by the American Heart Association, researchers examined 515 women who had experienced a heart attack. The results were eye-opening. A staggering 70% of these women reported feeling unusual tiredness before their cardiac event. But why does this happen? Imagine your heart as a powerful engine, working overtime during a heart attack to pump blood despite blocked arteries. This extra stress and strain can leave you feeling completely drained, even when you haven't exerted yourself. So if you find yourself feeling fatigued to the bone with no apparent reason, it's time to pay attention. Dismissing this symptom as just a byproduct of a hectic lifestyle could be putting your health at serious risk. Number 4, bloating, nausea, or poor appetite. When it comes to heart health, we often fixate on the classic chest pain or shortness of breath. But did you know that your digestive system can actually be trying to send you critical warnings about your heart? Feeling bloated, nauseous, or just completely uninterested in food? These seemingly unrelated gut symptoms could be a sign that your heart is in distress. Here's how it works. During a heart attack or heart failure, your heart is not pumping blood efficiently. This causes fluid retention and diverts blood away from your digestive system and towards more vital organs like the brain. The result? that uncomfortable bloated feeling, persistent nausea, and a total lack of appetite. Over time, this can even lead to unintentional weight loss and muscle wasting as your body struggles to function properly. So if you find yourself suddenly losing your appetite or feeling queasy without any obvious explanation, don't dismiss it. Number 5, sweating. Sweating when you're hot or exercising is perfectly normal. But what if you find yourself drenched in sweat while sitting still or when it's cold outside? This unexpected sweating could be a red flag for something much more serious, like a heart attack. When your arteries are clogged, your heart has to work overtime to pump blood, causing your body to sweat more in an effort to cool down. If you notice excessive sweating along with other warning signs like nausea, dizziness, or lightheadedness, it's crucial to seek medical attention immediately. Don't ignore these signals. They could be saving your life. Number 6. Difficulty breathing. Breathing is so automatic that we hardly notice it until something goes wrong. Shortness of breath or the sensation of not being able to breathe efficiently is a clear sign that something is amiss. You might feel like your lungs are heavy or find yourself breathing rapidly and shallowly. While anxiety, anemia, or allergic reactions can cause this symptom, it's often linked to lung or heart problems, particularly in women. No matter the cause, shortness of breath is a serious symptom that should never be ignored. If you experience difficulty breathing, seek medical attention to ensure it's not a sign of something more severe like a heart issue. Number 7, lightheadedness or dizziness. Feeling lightheaded or dizzy can be alarming, especially when it strikes out of nowhere. During a heart attack, your body might be deprived of oxygen due to a blocked blood supply to the heart, leading to dizziness as your heart struggles to pump enough blood to meet your body's needs. While dizziness can also be caused by stress or dehydration, persistent or unexplained dizziness should never be ignored. If you experience this symptom, it's essential to consult your doctor to rule out any serious underlying issues, including a potential heart attack. Number 8. Swollen legs, ankles, or abdomen. Swelling in your legs, ankles, or abdomen can be more than just a sign of a long day on your feet. This type of swelling, known as edema, occurs when fluid builds up in your body. During a heart attack, the heart's ability to pump blood effectively is compromised, causing blood to back up in your legs, ankles, and feet. Additionally, the disruption in blood flow affects the kidneys, making it difficult for them to remove excess sodium and water from the body. Fluid retention is a symptom of a heart attack in about 20% of cases. If you notice this swelling in yourself or someone else, it's crucial to act quickly. Seeking medical attention promptly can significantly improve the chances of preventing further complications from a heart attack. Number 9. Trouble sleeping. Struggling to get a good night's sleep could be more than just a nuisance. It might be a sign of serious health problems. According to a study in the journal Current Cardiology Reviews, people who experience restless sleep are at a higher risk of heart disease. During a heart attack, the left coronary artery can become blocked by fat or a blood clot, restricting blood flow to parts of the heart. This lack of oxygenated blood causes certain areas of the heart to malfunction, triggering the release of stress hormones like adrenaline, noradrenaline, and cortisol. These hormones can cause various issues, including trouble sleeping. If you find yourself tossing and turning all night without any apparent reason, it's important to take it seriously and consult a doctor. Number 10. Persistent flu. If you catch the flu and can't seem to shake it off, it might be more than just a stubborn virus. It could be a warning sign. Research has shown a significant link between the flu and an increased risk of heart attack and stroke. A 2018 study found that the risk of heart attack jumps 6-fold within a week of a flu infection. While influenza itself doesn't directly cause a heart attack, it can reveal underlying health issues that make you more susceptible to heart disease and other cardiac problems. If your flu symptoms are accompanied by an unusually high heart rate, shortness of breath, or other signs of heart trouble like chest pain or pressure, it's essential to consult a doctor. These could be early indicators of serious cardiac issues. Heart attacks are a leading cause of death worldwide, but the sobering truth is that many of these tragedies could be prevented. The key lies in paying attention to the small, subtle signs and taking action before it's too late. Remember, your heart is the engine that keeps you going. Treat it with the care and respect it deserves. The small steps you take today could mean the difference between life and death tomorrow. So, did you find this video informative and helpful? Let us know in the comments below. And be sure to subscribe so you never miss another vital update that could save a life.